Hey everyone, this is Dr. Matthew Hernandez with Ethos Integrative Medicine, where I specialize in regenerative orthopedics and sports medicine, and this is our approach to joint pain. Why I like this particular approach is, first and foremost, it's comprehensive. I often get people that come into my office who have been treated for the same joint pain before, and the treatment worked temporarily, but then the pain came back. And it's usually because not every facet of the joint pain was addressed. And this approach allows us to evaluate each facet, and we're going to talk about each one. That allows us to give us an accurate diagnosis, and it improves our treatment outcomes because multiple different treatments treat different parts of joint pain. And so that really allows us to figure out a comprehensive approach so that we can make sure we get the right treatment. So the first aspect that we're going to talk about is articulation. And when we discuss articulation, I'm basically asking what is going on inside the joint. What's going on with the capsule that surrounds the joint. If we're looking at the knee, is the meniscus worn down or torn? If we're looking at the cartilage, has the cartilage been worn down? And then if we're looking at the bone, do you have bone spurs that are kind of causing your pain and limiting that range of motion? So each of these are different things that I'm evaluating when I'm looking inside the joint or the articulation aspect of joint pain. The next part is symmetry. So when I discuss this with patients, the question I get asked are you saying I'm asymmetrical? Well, maybe, maybe not. What I'm looking at is structural symmetry and muscular symmetry. Now, structural symmetry has to do with the alignment of your spine and the joints. Muscular symmetry has to do with muscle and balance. So are you more developed on the muscles around your right shoulder than you are on the left side? So the analogy I like to use is that of a car that has tires that are constantly wearing out. So if you have a car where the tires are constantly getting worn out and you're having to constantly replace them, there's usually a problem with your alignment. So you can go and replace the tire all you want, just like you can go and treat joint pain all you want. But if you're not addressing the alignment, then we're missing something there. So the next aspect is stability. And with stability, I want to know, are your joints bulletproof? And the things that make your joints bulletproof are the muscles, ligaments, and tendons that surround it. So we're going to be looking at muscular strength, muscle activation. We want to look at, is there ligament laxity? So are the ligaments really loose? And then is there any tendinosis, tendinitis, anything like that of the muscles? And so we want to make sure that all of these are good. That way we have a stable joint. And then this last thing is neuromuscular. So with neuromuscular, I'm basically asking, are the nerves and or muscles pissed off? And here I want to look at, is there nerve irritation by the joint? Is there a muscle strength issue, muscle activation issue? Are there trigger points? So nerve irritation can cause trigger points, which can then cause changes in muscle strength, changes in muscle activation, and vice versa. Trigger points can cause nerve irritation. And so we want to make sure that all that is healthy and that the neuromuscular aspect is being addressed properly in order to prevent that pain from continuing to bother you. Oftentimes joint pain isn't inside the joint, it's just the muscles and nerves around it. So if you want to learn more, I discuss each of these in more detail, and you can check those videos out on our YouTube channel. I also have a discussion with an orthopedic surgeon in Nashville that uses the same approach in his practice, and you can listen to that on the Ethos Athletes podcast. If you'd like to learn more about our clinic, please check the description below, and we have our website info there. Otherwise, I hope this was helpful for you. Thanks for taking the time to watch this, and I hope you have a great day. Otherwise, I hope this was helpful. Thanks for taking the time to watch this, and have a great day.